Dr. Uché Blackstock now to talk a little bit more about this. Dr. Blackstock, the CDC is now predicting there could be up to 19,500 new COVID deaths the week of Christmas alone. And this morning, Dr. Fauci warned that the surge from Thanksgiving could coincide with people just starting to get on the road for Christmas holiday plans, and that could make it even worse. How worried are you about that possibility?
Well, first, Kasie, thank you for having me. I'm deeply concerned. We're already seeing hospitals at capacity, resources stretched, healthcare workers incredibly overwhelmed, and I think that we're reaching a breaking point, and this is where we're going to need governors to step in and put in those restrictions, just as Governor Newsom has done, closing those non-essential businesses, but still, keeping schools open, hiking available, so that people can still enjoy the outdoors. But we're heading into a critical time, and we should all be deeply concerned.
So, Doctor, I want to show you a little bit more of what Dr. Fauci had to say to my colleague Savannah Guthrie when he appeared with her this morning on the Today Show. She asked him about Joe Biden, the president-elect's plan to ask people to wear masks for the first 100 days of his presidency. Let's take a look at what he said, and then we'll talk about it.
I spoke to him about that. What he wants, he just wants to get, and it's a good idea, uniform. He's saying, hey, folks, trust me, everybody for 100 days. Now, it might be that after that, we still are going to need it, but he just wants it, everybody for a commitment for 100 days. And I discussed that with him, and I told him I thought that was a good idea.
What's your take on that policy? Do you think it is a good idea? Does it go far enough? And what chance of success do you think it has?
I think President-elect Biden is trying to get buy-in from those folks who, don't really believe in masks. And so by saying 100 days, I think hopefully they'll be amenable to that. Obviously we know that wearing masks work. We have the data. We know that it can save tens of and even hundreds of thousands of lives. And I know that Biden, is opposed at this point to putting in a nationwide mask mandate, but I'm hoping that we won't even get to that point. I think he's going to need to work with governors around issuing mask mandates on a state level. And we know that mask mandates really are only one part of a wider strategy to controlling the virus.
Before I let you go, I know you do so much work with health equity, and I'm wondering about the vaccine, and particularly faith that people of color will have that the vaccine is safe for them, and the work that needs to be done to convince them that that's the case. What's your sense of what's going to be needed in that realm? And would you take the vaccine yourself to encourage people to do it?
Well, yes. Yes, I will take the vaccine, and taking the vaccine, I take it out of love. I love to protect others. But I will say that, the healthcare and healthcare institutions have really proved untrustworthy historically and even in current day to Black communities and other communities of color. So it's truly up to vaccine manufacturers, departments of public health to get out there with outreach and messaging to Black communities and other communities of color to explain why this vaccine is safe, the importance of taking the vaccine, even transparency about the process of vaccine research and development will be incredibly key. And we need federal funding to go towards campaigns around outreach and messaging as well.
All right. The founder and CEO of Advancing Health Equity, Dr. Uché Blackstock, thank you very much for being here with us today.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.